What's up, everybody? Welcome to the Better You Project, optimizing health, hormones, and aesthetics. And today I have an extremely special guest, someone that I have admired for a very long time in the aesthetic world. I've got Dr. Mark Hamilton. Dr. Hamilton owns Hamilton Facial Plastic Surgery down in the Greenwood area. He specializes solely in facial, plastic, and reconstructive surgery. As a recognized leader in the field, Dr. Hamilton has authored multiple publications and lectures widely with his colleagues on all aspects of facial plastic surgery. He has been selected by his peers as one of Indianapolis Monthly Magazine top docs and has been recognized by Castle Connolly Top Doctors in America for his work in facial, plastic, and reconstructive surgery. He is actively involved at the IU School of Medicine and resident teaching, as well as a clinical assistant professor there. Dr. Hamilton is board certified both in by the American Board of Otolaryngology and the American Board of Facial Plastic and Reconstructive Surgery. Dr. Hamilton graduated Phi Beta Kappa from IU, where he also received his MD degree. He has received a merit-based scholarship while in medical school and was recognized nationally for his research. He has completed his residency in Otolaryngology-Head and Neck Surgery at St. Louis University and followed this by completing a facial plastic surgery fellowship through Indiana University. He has served a variety of leadership positions in the American Academy of Facial Plastic Surgery, including chairman of the Emerging Technologies Committee, Young Physicians Committee, Credentials Committee, and Public Information Committee. In 2009, he was awarded the 1887 award, nationally recognizing his commitment to AAFPRS Foundation. He is also on the board of directors for the American Board of Facial Plastic and Reconstructive Surgery and has been selected to author questions for the exam and serve as an oral examiner. He is a previous president of the Indianapolis Medical Society. His specialties include facelift, and I'm going to butcher this word. Dr. Hamilton, help me out here. It's rhitinectomy.
So that's facelift and rhinoplasty. And
okay.
You can skip the rest. Facial plastic surgery I do. That's great.
Yes, perfect. You also do hair transplantation as well?
So I've done hair transplantations in the past, and my days of hair transplant work are kind of over, but I do have a lot of experience in it.
Perfect, because we get that question a lot. And then you also do some laser resurfacing as well?
Yeah, I would say the main things I do are facial rejuvenation, which would be eyelid surgery, facelifts, brow lifts, laser, and then rhinoplasty.
Yes. One thing that I do know this about you that is not on there, you also train quite a bit for Allergan, correct?
I did for years. I did training for injectables with Allergan.
Yeah.
Again, my
days. I first met you.
Yeah, years ago, and got to come to your beautiful office back then. Yeah.
Yes. Okay. Well, perfect. Well, I'm so excited to have you on this episode. As someone who does a lot of integrative medicine, functional medicine, and really trying to optimize health from the inside out, one of the things that I feel like I get questions on all the time is, what is this Ozempic face? And how this even came about is you have already done an interview about Ozempic face, and I saw it. And I'm like, I've got to have Dr. Hamilton on my podcast about this. So let's talk a little bit about your practice. And I know that you've got a very busy practice and you go, if you're in the Indiana area, his main location, from my understanding, is in the Greenwood area. And then you also come up to Carmel as well, correct?
Yeah, I'm probably more up in Carmel than Greenwood now.
Okay.
But the office that I share in Carmel is with emerging plastic surgeons. And then I'm in Greenwood. That's just me down there.
Okay, perfect. So, all right. So let's first start off by explaining a little bit about what happens to facial fat pads.
Barbara Hamilton.
Oh, are you okay? Get it? Okay, good. So what happens, when in our practice, when we're doing consults on peptides, we talk about, all the things that are important when we're trying to help someone lose weight. We focus on protein and nutrition and making sure patients are consuming calorie-dense foods. But what unfortunately also happens is the hormone deficiency process, right? So as women are losing estrogen, they're losing the production of collagen and elasticity in the face. So pair an aging face with a fat loss face, and now we've got what we call, I'm air quoting if you're not watching it on the YouTube, is Ozempic face, right? Mm-hmm. So let's talk a little bit about that. So can you explain to us a little bit about the process of what is happening in that? I just want to debunk that we lose fat everywhere. It's not, we can't spot, unless you're like doing localized liposuction, you can't really spot reduce by systemic weight loss. So talk through that process a little bit.
Well, when we talk about Ozempic face, that comes from a term that a dermatologist in New York coined when he was seeing these patients on these drugs, which I'm sure we'll talk about all the benefits. And there's lots and lots of benefits.
Mm-hmm.
A strong believer in them. But he realized how they were losing volume in their face, and as you said, elsewhere on the body. But particularly where it was most visible is on her face, and that led to a variety of ramifications, including more wrinkles, more sagging, and just a more gaunt appearance.
Right, absolutely. And so what happens with peptides like semaglutide, tirzepatide, which is a newer one, and then if you can believe it or not, we actually just got a new one, cagrilintide. So that one's a little bit different in that doesn't act on the GLP-1 receptor. It's actually an amylin analog, so it acts on the medulla of the brain. So the way I describe to patients, like we're hitting different receptors. But what's so great about these peptides is it can help with cravings, portions, appetite, inflammation. It acts on the hypothalamus of the brain. So while we have all these amazing systemic effects, we're seeing all these changes from an aesthetic appearance. So besides fat loss in particular, what would you say are the biggest contributing factors in the aging face? Like, again, in our practice, we focus on nutrition and lifestyle, but like if you see someone, like, what are the key things that you're asking those patients?
Yeah. Well, aside from genetics, there's one thing we can't control, where the genes that we have really do affect our aging.
Sure.
But the two biggest enemies that I see are sun and smoking. Those are the two biggest things that I think contribute to aging in the patients that I see in my practice.
Yeah.
And so
absolutely.
the number one thing we talk about is, before we talk about all the fancy skincare products, is being careful about the sun and sunscreen.
Yeah, absolutely. So let's talk a little bit about the role of hormones. And I know that this is not really your area of specialty, but as someone, and you and I have kind of talked about this before, as someone who replaces hormones, if you were doing like a facelift, for example, on someone who is, I would say, hormonally optimized versus someone who is on nothing, what does that look like to you, like when you're doing the procedure?
Well, when we talk about the signs of aging, one of them is a decrease in hormones, and that leads to some of the changes that we see in the skin and the tissues of the face. So if somebody is not hormonally optimized, they're going to be behaving like somebody who's 10, 20 years older. And in those situations, whatever I do, typically the tissues are a little more challenging. They don't hold as well. We honestly can't get as good of results. So I do really strongly believe if you're really trying to get the best results from a surgeon standpoint, optimizing your hormones makes sense.
Absolutely. I think not only that too, but I think it can actually help with wound healing as far as accelerating some of the closures of the tissue because it's not so friable and like weakened, because when you've got that little bit of extra estrogen on board, or not even extra, you're just replacing what was lost, it can really help with fibroblast production, type 1, type 2, or type 3 collagen, and all those other things. From a lifestyle perspective, you mentioned smoking, which I think, that's like a no-brainer, right? But the other thing that I see a lot in my menopausal patients is their addiction to wine. It's like they're using wine to wind down. Would you say, in your experience, do you notice that does play a role in either, the acceleration of the aging process or even the recovery of a facelift?
Yeah, it's interesting, Lexi, and I applaud you for talking about this because everybody avoids the topic thinking there's only talking about the benefits of wine, and there are so many negatives from a health standpoint.
Sure. Oh, sure.
You almost hate to say it because people don't want to hear it, but it is true.
Yeah.
Probably the biggest issue for me when it comes to surgery is if somebody is drinking wine regularly right up to the day of surgery, they're going to bleed more, they're going to bruise more, and they're going to have a tougher recovery.
Yeah. Going back to with like Ozempic face, are there certain places of the face that you notice more of those fat loss areas versus other areas, or is it like ethnic dependent? Is it, can you give us a little bit of information as far as where do you see that fat loss?
Yeah, interesting you mentioned. I'm not sure that there's any differences in terms of ethnicity, or I haven't seen a study with that, but the typical areas there I see it is from top to bottom, the temples, that fat is very sensitive. The cheek area, that's an area where we really see significant volume loss. And then just along the orbital rim, that area can be where you really see a change over time as patients lose weight. And those are the areas that we really focus the most on when we're talking about revolumizing.
Right, right. Yes, I feel like I'll see those patients where they've got this like hollow appearance, they've got like, and then they want their cheeks done. And I'm like, no. I don't want to make you look like Maleficent. Like we've got to look at your pan-facial fat pad.
Yeah.
So I think that's really important to kind of note. So let's say you have a patient and they're coming in for a consult and they have lost, I don't know, 50, 60 pounds, and they're coming to your office. Talk us through what that process looks like. So they come in for a consult. I assume there's definitely a lot of intake, H&P that you're doing, some photos. Yeah. What is like the average age of a patient that you would see for something like that?
So I think we're seeing patients just in terms of facial rejuvenation of all ages, surprisingly young, sometimes even in their 30s. And we've had patients coming in their 80s. So all age groups, but there definitely is, we have seen more of these weight loss medications, peptide medications. There's definitely some things I want to look at. Number one, I want to see that they're not on a declining status in terms of their weight, that they've actually plateaued, they're stable before we consider any sort of facial surgery. So that's important. Number two, go ahead. Do you?
I was just going to ask. So, like, and I asked this because I used to work in the bariatric world. So, do you say, I want you to have maintained your weight for at least 6 months or 3 months, or do you have like a timeline for that?
So, in general, I like to see it for 3 months. That's kind of my guideline. I have to be in a stable weight for 3 months at a dose of the medication that they're going to stay at or close to for the long term, more often.
Yeah, absolutely.
And then once we determine those things and a variety of factors in determining what procedures are right for them, there's also, if they are still on the medication, it's important that they stop it before surgery. My procedures are done with anesthesia. You have to be NPO for that. Usually we say that's overnight. But for somebody on one of these medications, because of delayed gastric emptying, they can have food in the stomach for a week, 2 weeks out, which is a danger when you're putting somebody to sleep. So we have them stop those medications now 2 weeks before surgery.
Okay, awesome. And then as far as when you're doing a facelift procedure, does that automatically include like an upper bleph, a lower bleph, a neck, or like, so when I'm saying the term facelift, forgive me because I don't know, what all procedure wise does that include?
Yeah, and that's a great question because a lot of patients aren't actually sure what facelift means. In general, for me, and I think for most facial plastic surgeons, a facelift is about from midway down the face, the lower half to third of the face, and the upper half of the neck. That's really what a facelift addresses primarily. But we often will do other procedures at the same time. Maybe we'll do the brows or brow lift. Some people consider if you do those two together a full facelift. Eyelid surgery is a separate thing, but we absolutely can do that at the same time. And in these patients, I think a big thing that's important is replacement of volume, whether that's with implants or with fat grafting at the time of surgery. And fat grafting is really more my favorite right now.
So that's going to be my next question. So let's talk about that. Where on their body are you taking the fat from?
Oh, that's a great question. I think we've kind of changed over time and trying to find the ideal spot. But generally, I try to take it from the midsection, the abdomen, the flanks. Those are relatively safe places for us to take fat and not worry about long-term other cosmetic issues. And most people we can find fat in those areas. If we can't, sometimes we'll go to the inner or outer thigh, try and find fat in those areas.
And so because of how you're boarded in cosmetic and facial surgery, is that something when you do that procedure and you're doing a fat transfer, do you have to bring in another surgeon to do the fat grafting piece of it for you to kind of help?
Sure. If I was doing fat grafting where I was really trying to contour, or they wanted to contour their body, then absolutely I would want a body surgeon there.
Right.
I'm getting a small amount of fat, though, when I'm just doing fat grafting. Nothing that's going to provide them with a whole new look to their midsection. Or so it's not something we really need a full body surgeon for.
Okay, great. No, I think that's really important to note, because I think sometimes if I were to hear, patients say like, oh yeah, they're going to suck some fat out of my flank, and then I'm like, oh, and then, you know what I mean? Then they're thinking they're coming out looking like this hourglass shape. And it's like, ma'am, we just needed a little bit to fill up your face. So
no, we explained that to them. I said, we don't need much. It's not like we're going to change the contour here. It's really just to harvest the fat. But if they do want to do that, that's one of the nice things about working at the Emerging Plastic Surgeons. I've worked with body surgeons before, just past week, where Dr. Christine Kelly came in and she harvested the fat and contoured it, looked great. And then I took the fat and did the injections.
That's awesome. I actually just had her on my podcast 2 episodes ago, and she was on there as well. So that's awesome. My next question is it's a good one, because everyone's on Teams and on Zoom, and everyone sees their face now, right? So the rise of aesthetic injectables has been tremendous post-pandemic, right?
Yeah.
Now, I also feel, and I don't know if you've noticed this, but I also feel like a lot of people want fat transfer, or they want PRP, or they want biostimulation. I've seen it more in my practice, and maybe because this is the clientele that I attract, but people want like their own stuff and they want to regenerate it. Have you seen, like in your practice, a rise of patients wanting more of that, like a fat transfer or a PRP or like a biostimulation?
So I think all of aesthetic surgery has grown since the pandemic, just for the reasons you mentioned. All of these people were looking at themselves on Zoom, and we called it the Zoom boom, and became so aware of their facial features. And then I think the younger patients with social media are much, much more aware, not only of what the features are, but what can be done.
Yes.
So absolutely all those things I think have increased. Different roles for each one of those. I think fat grafting has a role, fillers have a role, the biostimulators like Sculptra, they have their role. So it just depends on the patient.
Yes. Is there anyone who would you say is not a candidate for a facelift?
Well, there's lots of patients who aren't candidates.
Okay.
Smokers aren't candidates. There are certain conditions that patients may have, such as Ehlers-Danlos, where they're not as good a candidate. People with history of radiation therapy to the face probably aren't a candidate. So there are several patients categories that are not candidates for facelifts. Fortunately, that's a pretty small minority.
Right.
Most patients are good candidates.
Yes. So if you're a patient, you're listening, Ehlers-Danlos is a connective tissue disorder that can make operating and grabbing tissue and picking up tissue very, very difficult. And then the reason with the radiation is that unfortunately radiation can cause that tissue to be very, very like friable, it's hard to pick up. It's hard to pick up.
And so a good blood supply either.
Yeah. My next question kind of stemmed from, speaking of social media, there was some talk. There was a plastic surgeon on there, and he was saying that if you plan to get a facelift, that they would not recommend doing something like a Sculptra. And I thought it was really interesting. I had not heard that before. And so my question would be, if someone has had Sculptra before, does that make doing like a deep plain facelift more difficult? Has that not been your experience? Like, you've been doing this such a long time. I'm very curious to see what you think.
Yeah, and I think I know the same
there were
social media posts you're talking about. And the pictures that were shown, I was a little shocked. I've never seen anything like that, ever. And I've done many patients with Sculptra and other products. So I'm not sure. He's a very experienced and well-recognized surgeon. He's just had some bad experiences with those products. I have never run into anything like that, and it's never been a major concern for me. I do think hyaluronic acid fillers, if somebody has a lot of them, they might swell more after surgery. I do think that's true. But in terms of limiting what I can do surgical wise, in terms of a facelift, I've never really thought it was that much of an issue.
Oh, that's so good to hear. I actually was doing the Sculptra today, in fact. And I had the patient ask me kind of something similar. And I said, you know what? I actually have an amazing surgeon on my podcast tonight, and I will ask him that question. So I'm so glad that you said that. Out of curiosity, so you mentioned the fillers and potentially delayed, or I'm sorry, you said swelling on that. Have you ever had like any like run in with like a calcium hydroxyapatite? Only because of it's like a spherical molecule, and it's a little bit of a thicker kind of almost like a concrete-y plaster material in when you're injecting it. So what does that look like for you, or does that cause any issues, or no, not really?
Fortunately to date, no, I have not. And I'm sure many of my patients have had that, many who haven't even told me that they've had it.
Yeah.
And I've never, ever experienced something like that where I thought, boy, there's something going on here that's a problem. So while I think that those things do stimulate and can cause some deposition of whatever we want to call it, collagen, scar tissue. In general, Sculptra thickens the skin. It brings a healthier skin, I think, that is going to do better with a facelift. That's my personal feeling.
That's great. No, that's good. So there was a rise, I'm sure you know, of PDO threads. And I'm dying to know, what has been your thoughts on that? Only because I've heard, from just conferences, kind of like, honestly, if you're going to do a facelift, they're a pain in the ass, really, is more problem than anything. So what's been your experience with that?
Well, so fortunately, most of them go away fairly quickly. Mm-hmm. I know they like to say there's long-term effects, but usually by 6 months, they're pretty much gone, in my experience. The issues that I have more is seeing complications from them. Whether it be infection, or I had a patient recently who actually had some sort of scar tissue that made her muscles twitch when she'd blink her eye, things like that. I think that those really are fraught with a lot of issues that I just don't recommend those threads.
Yeah, no, that makes sense, especially with the trigeminal nerve and coming along that way. So no, that's super interesting. Let's see here. I'm just going through my questions here. There were so many good ones that I got sidetracked. Let's see here. So we had talked a little bit about the facelift and how you stopped semaglutide about 2 weeks prior to that. Do you have a recommendation of when you allow patients to restart it? And I asked it because a lot of patients will ask me, like, what can I do? So I'm curious to hear what you say, and then I'm going to say what I say.
Yeah, no, I think that's a great question that there's no real definitive answer yet. But obviously, during the period of after surgery, we want them to heal well, and nutrition is important for that. So you don't want to have them on a medication like that that's going to affect their intake of protein, nutrients, vitamins. My cutoff, I have them take right after surgery extra doses of vitamin C for 2 weeks. And so I wouldn't want them to restart that medication for 2 weeks. That's my general guideline.
Yeah. So to your exact point, I always say, if you're going to have some anesthesia or some pain medicine, those are actually going to slow down your gastric motility. So you're probably not going to be hungry anyway. And then not only that, in our practice, we have an in-body machine where we track everyone's lean body mass. And I tell them, okay, you see that number? That is your grams of protein goal, especially post-operatively, because I need to make sure you're getting enough amino acids in your body, because those are the building blocks. And so if I tell them, you want to really help your recovery, shoot for that many grams of protein. They're like, you're right. I wasn't hungry at all. And then not only that, sometimes you can get a little constipation after some of those, using some, anesthesia and some of the pain meds. And so I'm like, you don't need any help being constipated with semaglutide. So I think that's good. What's the typical recovery downtime post facelift?
Most patients are pleasantly surprised. It's usually less than they expect. My goal is always that by 2 weeks, with hair down, little camouflage makeup, that they would be able to get back out in public, and most are. So in general, you have a dressing the first night for 24 hours. You have stitches that are mostly absorbable that come out in a week. By 10 days, all the stitches are out, typically you can put makeup on. And again, by 2 weeks, the goal is to be able to get back out in public. So generally, it's not 100%, but usually it's much better than most people expect.
Yeah. If someone were to say, like, let's maybe do like an upper and lower blepharoplasty, not a full facelift, what's the recovery time? And I ask this because I have a ton of patients that I feel like need a blepharoplasty. So what is the recovery time like that?
It's kind of interesting. All my procedures are pretty similar time frame in terms of generally stitches in for a week, got to take it easy for 2 weeks, can put makeup on by 10 days. And the goal, again, is they'd be able to get back out in public by 2 weeks. With a blepharoplasty, maybe even a little bit sooner.
Great. No, that's awesome. Well, I think I've got all of my questions answered. I know it was like rapid fire. Is there anything, Dr. Hamilton, that you feel like we've not covered that you feel like is really important for either practitioners or for patients to know that we didn't talk about?
Yeah, I think one thing, two things actually. One, going back to Ozempic and Wegovy and all the Mounjaro, all these new products, it is important to remember that yes, they do cause facial volume loss, but there are so many health benefits in terms of lower heart disease, hypertension, stroke risk, cancer risk, diabetes, that they far outweigh these benefits, these downside of the facial volume loss. And I'm a cosmetic surgeon, and I'm saying that.
Yeah.
So we can treat those things. The other things often are very difficult to treat without getting that weight off.
Absolutely.
And two is that we do have good ways to treat it, including non-surgical. As you know, we can do things like Sculptra or fillers in the office and can do a lot with those. And then if it's more than that, we can see it for facial surgery and really restore what you've lost from those medications.
Yeah. No, absolutely. Absolutely. Well, thank you so much for taking the time to answer all these questions. Like I said, it was so funny. I was like today doing Sculptra and someone asked me this question. I'm like, oh, great. Where can people find you, Dr. Hamilton?
Well, probably the best thing is my website, www.hamiltonfps.com.
Okay.
And from there, I'm happy to talk to you. There's lots of information on there, including you mentioned publications that I've done before, blogs, lots of before and after pictures, and videos now.
Yes, absolutely. So I will tag all of Dr. Hamilton's Instagram handles and socials because I need to do all of those things as well. So we get all of his information out there. He is located in Indiana. He has a space out in the Carmel location over at Meridian Plastic Surgery. And then he also has a location in Greenwood as well. So we will end the podcast with a good note as far as thank you again. We've enjoyed this time and hope to have you on again.
Yeah, thanks so much, Lexi.